Mustaf is a boy with SCID, or what people may have previously referred to as a boy in the bubble disease. So he was born without any immune system. So because of a genetic defect, his bone marrow cells couldn't give rise to an immune system. Those are the white cells in our body that are there to fight infection. And as a result, when we first met him, he hadn't grown, he had severe chest infections, and he had urinary tract infections as well. So at about the age of 3 months when we met him, he was really very, very unwell. And what we've been able to do with gene therapy is to give him a new immune system. We've actually been able to repair his immune system so that now he can mix with other children, play with other children, go to parties, just lead a normal, functional life. And the way we've done that is by knowing what the gene defect is, the gene that in his bone marrow is faulty and can't give rise to an immune system. And what we've been able to do is to take out his bone marrow and introduce into his bone marrow a healthy working copy of that gene and give that bone marrow back to him so that his bone marrow now has the signal and the right message to build a new immune system. And what we're so delighted about is the fact that this has now been functioning for nearly 8 years. So we treated him in December 2003, and here he is now 7.5 years later with that immune system actually still growing, still functioning normally. We think that actually that will just continue, and shouldn't kind of fade away over time. In fact, what we've seen over the time is that it's actually grown and it's got stronger. He's now off all of his medications. So we're extremely pleased. He's responded to vaccination, so we're extremely pleased with the way it's gone. And as I say, I think it will just continue to stay as it is, if not improve slightly over time. We've continued to treat patients, and we've treated 10 patients on one study and 6 patients on another study. And as we've shown, 14 out of those 16 children have been able to develop a functional immune system as a result of the gene therapy, and only 1 patient has developed a leukemia. But as I say, we do understand that there may be some risk, and that's why we're already starting to develop newer treatments and safer treatments.